This is going to be a really amazing conversation about health and well-being. I'm in this room because I'm passionate about health. I think that's the same for all of you. We know that health impacts everything in our lives, and that's why it's been a priority for MAP and the residents that have been working so hard this whole time. We believe it connects to safety, we believe it connects to opportunity, all of it. So today, what we're going to do together is have a roundtable discussion about health and well-being. And our speakers are Dr. Torian Easterling. Do you want to wave? So that's Torian. We have Ms. Shipman. Hello. And Ms. Chappell. So, Ms. Shipman, can I ask you to introduce yourself?
Good morning, everyone. My name is Lohoma Shipman. I'm a resident of Bushwick Houses, and I'm also the RA president.
Thank you. Ms. Chappell? Oh, you're muted.
Good morning, everybody. My name is Alaire Chappell. I'm a resident stakeholder in Dyke Houses.
And Dr. Easterling.
Good morning, everyone. My name is Torian Easterling. I am currently a resident in Bed-Stuy, in the Ocean Hill very soon. I am from Newark, New Jersey, and I currently serve as the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene.
Thank you so much. Okay, so I'm going to ask Ms. Shipman to begin by sharing a little bit about the work that your team has done.
Hello, good morning. My name is Annette Williams. I'm from St. Nicholas Housing with the MAP program.
Good morning. Thank you. Thanks for being here. We just got through our introductions for the speakers. So today we're talking about health and equity. And Ms. Shipman is going to share a little bit about Bushwick Houses and how she's prioritized health.
So basically, when the pandemic hit, we noticed that it shined a light on a lot of the inequities in our neighborhood as far as food insecurities. So we started a pantry, a food pantry, where we were operating 6 days a week, provide food to all the residents throughout the development and within the Bushwick community. We were getting food for seniors from the city and but we noticed that the remaining residents weren't getting anything and there was a need. So we started that. We reached out, we partnered with various CBOs, and we were getting fresh fruits and vegetables along with other non-perishable foods. Also, we were also able to get other items like Pampers and baby food for residents, and as well as pet food for those that also had pets. So during the pandemic, we could basically say that no one was left out. We were able to provide services for pretty much everybody. Also, we had a couple of times when we had organizations with the help of the governor that had came and did COVID testing in homes because people didn't leave their homes to go get tested. And then last month, we also partnered with a private doctor that came out to the community center and also provided some COVID testing. Should I stop there, Tara? You want
That's
me to?
beautiful. Thank you. I think that gives us a lot to work with. Ms. Chappell, can you share a little bit about what you've done with the Van Dyke team?
Yes, I'm going to kind of just, well, a little more thoroughly share our process and why we prioritize health and well-being at Van Dyke. So I'm going to start with the very beginning of our journey, my journey, right, which led me to meet these fabulous people that I work with out here in Van Dyke. It says, I have been a member of the Stakeholder team for 3 years, almost as long as I've been a resident here. When I got involved with NStat, I merely joined because I was interested in being active in my community. When I joined, I knew very few of my neighbors and was pleasantly surprised to meet this group of people who, like myself, wanted to make a difference in a community. Everyone on the team either was born in Van Dyke or had lived in the development 2 or more decades. They had a vision of Van Dyke as it once was and wanted to restore the community to the former state, which we knew was going to be a difficult task, but we're committed and we're going to do what we need to do to make that happen. After a couple of weeks of training, we began the process of assessing the problems that plague our community, many of the same problems other Black and brown communities face in New York City and around the country: high employment, homelessness, drugs, violence, mental illness, decadence, and chronic disease. And of all these problems, we realized that chronic disease would be easier to address. In addition to this, many of us in the group were dealing with one or the other of these conditions ourselves, so we could relate to this subject personally. The next step in our process was to look at the data compiled by the Department of Health. And we learned that our community, Brownsville, had the highest rates of deaths caused by heart disease, diabetes, hypertension, obesity, and cancer. And that people who live here live 10 years less than others in all of New York City. So we seriously wanted to make this our priority issue. In planning, we discussed the many aspects of wellness with diet and lifestyle being our focus. However, we also wanted to tie in community cohesion. We wanted to bring back the sense of unity that once was a part of this community. So we decided to bring awareness to these issues by creating events that would educate and activate our residents, and do some beautification projects throughout the development that would add a sense of pride, unity, security, and hope back into this community. Some of the events staged were cooking workshops. We had fitness trainers come in and we held exercise classes, indoor and outdoor classes. We did a 3-on-3 basketball tournament for our youth. We did a paint and sip where we introduced juicing to the residents. And one of our local farmers held a herbal tea workshop where we taught our residents about medicinal uses from drinking teas. Right around, after we did all of this, COVID hit. We were in the middle of a beautification projects that we were working on that we decided to do. So what we did was we redirected our resources to providing boxes for our residents and who needed our help.
I'm sorry, Ms. Shipman. Can I ask you to pause for 1 minute? I mean, Ms. Chappell, I'm just going to mute everyone. Okay, go ahead.
Yeah, so, that kind of brings us up to where we are today. We are now in the process of finishing a lighting installation that we were working on to create a more harmonious and safe area in the development. Thank you.
Okay, and Dr. Easterling, would you like to respond and offer your own thoughts?
Sure, and just to be clear, just doing an introduction, not going into questions because we may go into the video next.
So take it where you will, and we'll play the video when we can.
Okay, sounds good. Well, first let me just say that I'm deeply humbled to be joining you all, and really happy to have met and been speaking with Ms. Shipman and Ms. Chappell over this week to really just know one another and hear about the great work that they've already been leading. And so I think in this dialogue, one of the things that under my leadership, both in Brooklyn, and then as I have been promoted in the agency, I think showing up in community has been one of the principles that I've stood on, and thinking about the ways that our resources within within our agency, within government, could be really used as a tool for deepening partnerships and really achieving outcomes that are co-created. And so part of the work at the New York City Department of Health and Mental Hygiene, and specifically, under the Center of Health Equity and Community Wellness, there's already been, sort of deep investments in communities, for the past decade and even longer, through our district public health offices, and now our action centers, our neighborhood health action centers. And I have been fortunate to have led the Brownsville Neighborhood Health Action Center, but we also have others. One is in East Harlem, and then another is in the Bronx, in Tremont, East Tremont. And some of the work that we have been really focused on is looking at causes that have led to premature mortality. And I think it's really important, and Ms. Chappell and Ms. Shipman and I, we were talking about this. It's really important to start in the context that health outcomes that we see and the inequities that we see are rooted in historical and contemporary and persistent racist policies and practices. And so if we do not start there, then having a conversation about the inequities in these health outcomes, we will certainly miss the target in them. And so as we have had our resources in the Department of Health, we've certainly been focused on, really making sure that, we're addressing, nutrition, physical activity, addressing diabetes, and addressing hypertension. But it is the approach that I think has been really important. And our approach in programming and our policies are saying, what's the work that's already happening on the ground, and how do we amplify that work to ensure that this is what the community has asked for, right? And so thinking about the environment in which people live and exist in, right? And how do we support it? One of the programs that we have really supported is our Shop Healthy program, really supporting healthy nutrition, healthy food in neighborhoods. This has been part of our work in Brownsville, in East New York, in East Harlem, and really working with bodega owners to really increase access to healthy food, ensure that residents, their organizations are thinking about sustainable food resources. So supporting our churches, supporting our schools, so that they are also thinking about how do we support our bodegas owners, because this is an economic opportunity, right? I mean, we have store owners, but we also want to ensure that those establishments are supporting the community. So that's just, one way, and one of the policies that came out of that is sort of thinking about how schools are partnering with those bodegas, because we know that our children are going directly to those bodegas and ensuring that they are connecting to and getting access to healthy food. Another way that we've been partnering, and particularly with with the community within Nice developments, in East Harlem, we done a lot around physical activity and food, but really around the physical activity side. And so in partnership with many of the Nice developments there, we created the East Harlem Community Walking Trail. And I think the policy that was really important that came out of it was the mobilization. I think that was really important, but we also ensured that there was a level of advocacy that was coming from the residents. And so as a participant in this walking trail, then we were also empowering individuals to think about, how do we make changes in the neighborhood? And so submitting 311 complaints about street conditions, right? Or challenges that we're seeing in the neighborhood. And so that we saw the number of calls made to 311 increased. And so that was certainly something that we knew was important, because, the number of calls that increased, and the higher chance of a response. And I think I would say that it was so important, in this process, is that, one, government needs to show up, right? And I think that's number one. How we show up, then I think leads to better outcomes, because we show up and our presence is there, but we're participating in meetings really as a participant, right? Not always leading it, not always co-leading it, not taking it over, not coming with preformed programs already, just coming with our ideas, but really sort of thinking about how are we creating those solutions together. And I think identifying both the challenges, identifying the resources, and co-creating those solutions, I think have long-lasting outcomes because there's more buy-in ultimately. And I think that's what we want to achieve. And I think those are the principles and the foundations that I think we want to certainly carry into this next administration. I'll sort of stop there. And I think that's just, sort of the intro into some of the things that, I've been thinking about just as a policymaker, as someone who's been leading program development and operationalizing work within city government. So thank you.
So Torian, you can follow up with questions to Ms. Shipman and Ms. Chappell, and Ms. Chappell and Ms. Shipman will ask you questions as well.
Great. Awesome. All right, so Ms. Shipman, Ms. Chappell, I've been thinking more about, sort of the work with the food pantries and the work that you've been doing with the team and the development. Definitely would like to hear from the both of you about how we have successfully participated in co-creating those solutions. Just sort of thinking about some of the work that you've already done and how have we not shown up very well or failed to do so. Because I think what would be helpful is in identifying those gaps is coming up with those solutions so that policymakers such as myself are also informing teams and our work in a better way to show up.
Well, may I respond?
Oh, go ahead.
Okay, well, me being new to the community, I don't have very much knowledge about the programs, that are here already. So, and I'm sure that a lot of the other residents in the development also don't have, information. Not all of them, many of them do, but I think we need to be able to get the information out within the community about the resources that are available to them and to us, in the areas of health and wellness. That's one of the things that I've been thinking about. I was on a partner's call the other day, and some of the concerns we were talking about an initiative that was done and basically just kind of tweaking it. But what I was able to gather was, us having like what do you call it, like distribution sites for fresh produce, because there was a farm, one of the local farmers that come out and was working in the community, and they've had grant monies. Their grant monies ran out, so they're still willing to work in the community, but of course it's not sustainable for them to work in work things of nature. So I was thinking about how we can maybe get additional funding that farm, so that they can continue to provide the services that they provide to us. And then there was concern about affordability. So I was thinking about the vouchers, getting families that are eligible and who want to participate in the food program to get some vouchers into their hands so that they can, afford to make, to purchase more fresh fruits and vegetables for families. And also I was concerned about, like the space, because of COVID and the distancing situation, the space was a little small. So I was thinking about, we got a lot of new developments going on in Brownsville, and, they have, most of these developments have a commercial space in them. So I was wondering if maybe we could even get some space where, the local farms can set up and, make it a little bit more, make it more easier, set up some kind of a distribution, make the distribution process a little more safer and for the residents. Yeah, those are some of the things I was thinking about. Thank you.
That was amazing, Ms. Chappell. Torian, do you want to respond?
Yeah, no, I think, I think, sort of thinking about sort of the trajectory of getting to health policy, I think that those are all spot on, right? Like how we are sharing information to build that level of advocacy, certainly, because then you're bringing that information to your community boards, you're bringing it to community council meetings, you're bringing it to your elected officials, like using, like information. And that could be data, that could be, stories. And I certainly think that's really spot on. And I think that has helped because we typically think about data and like numbers, and like, rates and populations. But I think qualitative information has also been really helpful, particularly over this pandemic, as we have been using stories to ensure that we're thinking about, changes around like policies in hotels and safely separating isolation and quarantine. So, I definitely hear the point that you're raising and appreciate it.
And Ms. Shipman, did you have a response to Torian's question?
Well, yes, actually, it was pretty much along the same lines as what Ms. Chappell was saying, but also if we can have like some type of database or something that lists all the resources that are available, or at least the points of contact that we can give to the residents. So depending on what the need is, especially if it's something mental health, with us all being confined and having to stay indoors, for somebody that's used to always being outside, that could be a little stressful. So at least if we had those listing of different organizations that they can reach out to and call, or even maybe they may be offering Zoom classes or something that they can get on to, so they have somebody that they can talk to, I think that would also be helpful. But in addition to the food, maybe if we had some type of way of either giving them some type of recipes or a link or something where they can go on to make healthy meals and use more of the fresh vegetables and stuff instead of the canned goods, that'll help them with the high blood pressure, the diabetes. So at least all of that will come together. We can tackle all the issues all at once.
Yeah, and I know that this has been something that has been thought about, right? Like, because just in my work in Brownsville and Bushwick in East New York, I know that the community boards have been really focused on making sure that information is available. I think what we have seen over time is that yes, there are residents who access those resources, but then there's also a swath of residents that are not connected to those sites. And so, really interested to hear, what other ideas to make sure that the information is widely available. Because I think that, I think that's something that's achievable and really, really doable, given some of the investments that have already been made, right? Like even through our agencies, Neighborhood Health Action Center, we've been like, thinking about where are the leading sites for, how do you get those, your issues elevated? Where do you go to learn like where this pantry is or this garden is that's also providing food, and I think we've certainly been working with the community board chair and the district manager as well, sort of thinking through that.
Thank you.
May I share another thought,
Please,
Tara?
please, and then we'll go
Okay.
to
I was thinking about, like billboards, right? These bus shelters have these large posters in them, right? And I thought that it would be a good idea to advertise use those to advertise, the different services around healthy options and things of that nature, information on how people can get information in the community, just being, one of the ways that information can be disseminated, because many of us don't go to the community board meetings, and so we wouldn't be privy to the information that's, disseminated there. But, you can't help but see these big posters on these bus shelters just in passing, or if you're taking the bus. I'm just thinking that would be that visual that, would be another way to get that information out.
It's an amazing idea. So because it's the elephant in the room that we all feel, I thought we should spend some time talking about COVID and the vaccine. Before we do that, I'm going to ask Patrice to play the Bushwick video because it's right on point. It demonstrates how Bushwick responded to the virus and really showed resilience. And then I'll ask Torian to speak. There's no sound.
Most of the nicer communities were forgotten and nobody thought about them, but thankfully Bushwick was one of those that was blessed. We had food constantly coming, we had other resources coming in, we had members from the community as well as some of the staff that work here at Grand Street Settlement that volunteered to help make sure the residents or anybody in the surrounding area. I just want to make sure that they know that we haven't forgotten them. And even after all of this is over, we'll still be here for them. I'm passionate because this is my community. I love it. I love being. I grew up here, and I love it here, and I just want to help. So we prioritize working together, building teams. I'm really passionate about this action plan because it's home, and we want to make sure that it's a success. So we are committed to making sure that it's fulfilled and see it through. I'm looking forward to starting either an urban farm or a hydroponic so that we're not always waiting for a donation. We can teach our young people and get our seniors involved in planting and growing our own fruits and vegetables. In light of COVID that has pulled the covers off of everything and we see how disadvantaged our communities are, I think the city can provide more funding. We need a bigger community center and at least one that is properly air conditioned. The gym has no AC and providing programs for our youth. I would just hope that when everybody goes and sit down at the table, that they will say, okay, you know what? This community didn't have the proper funding. Let's give them more. So hopefully this pandemic has opened people's eyes so that they will start providing the funding and resources that we need in our community.
Thank you so much. Okay, so Torian, can I ask you to take some time to talk through the health department's response to COVID?
Yeah, certainly. I think it's one couple ways that I sort of think about this. I think this has been unprecedented, and the challenge is certainly stacked up against us. But that there has been so many bright spots. Just like the video and folks coming together. And really organizing themselves to make sure that they're taking care of communities. And so I think that needs to continue. We are not out of the woods yet. The cases, hospitalizations is still going up. And so, and this is citywide, and this is certainly continue to be in Black and brown communities. And I think that's number one, right? We have not reached shore. We do have a vaccine that's available. But we need to continue doing what we have been doing for the last now 11 months. And so, with that, with the vaccine that is now here, we have 2 that are available. Our approach has been really trying to support New Yorkers to know more about this information, science-based factual information, address misinformation, but also support the right to have an informed decision, and ultimately making sure that New Yorkers know that it is their decision to take the vaccine. For us to protect New Yorkers, for us to reopen this city and get to a new normalcy, we need as many people taking the vaccine. But to get there, we know that that's the process, because we know that there is hesitancy. We know that there is misinformation. We know that folks have questions. We know that there is mistrust with government. We know that there's mistrust with our healthcare institutions. And so repairing and rebuilding trust has to be part of our process. And we recognize that, and we're certainly incorporating that into our plan. And so, conversations and discussions are certainly important, but also collaborations. And I think the mutual aid societies and the organizations and the resident associations that are here and available and supporting residents, that's how we're going to connect, because we truly see you as the leaders in making sure that that message is getting out. We're thinking about it. And I think more and more opportunities for us to have that discussion about how communities can support distribution. I'm happy to support that.
Thank you so much. I think we're going to get booted out of this breakout room and back into the main room, but I just want to thank the speakers so much, Ms. Chappell, Ms. Shipman, Dr. Easterling. It was incredible to hear from you. I think you can tell, Torian, that our teams have amazing ideas that we hope you'll support implementing, and looking forward to working with you.